Welcome to the Wilkes University Nesbitt School of Pharmacy blood pressure training video. During this video, we will be explaining and demonstrating the proper way to take a blood pressure. Before you begin, please introduce yourself to the patient, including who you are, where you're from, and the expectations for the assessment. You want the patient to be calm when taking the blood pressure, so before you begin, you will address the questions on the hypertension assessment. Please reference video 2 to learn more about the hypertension assessment. First, you want your patient to be sitting with their feet flat on the floor and their palm facing up and supported. When taking a blood pressure, it is important to use the proper resources for the patient you're with. Most patients will fit the standard adult size blood pressure cuff, but in some cases you will need to use a larger cuff. Many cuffs will have a range printed on them. To confirm the cuff is the appropriate size, you want to be sure the line fits in between the range. On most cuffs, there will be a label that shows where on the arm the cuff needs to be placed, based on which arm the blood pressure is being taken from. Place the arrow over the brachial artery located on the inner side of the arm. Wrap the cuff around the arm. There should be room for 2 fingers to fit between the cuff and the patient's arm. If not, it is either too loose or too tight. That could affect the reading. Next, you will palpate their pulse. Ask the patient which arm they would prefer the blood pressure reading to be taken on. Place the blood pressure cuff as shown before and find their pulse, which will be located in line with their thumb on the radial artery. Inflate the cuff until you can no longer feel their pulse. Deflate the cuff slowly until you feel 2 beats of the pulse again. This is called the palpable systolic blood pressure. Note the millimeters of mercury. You will add 20 to 30 to this number when inflating the blood pressure cuff. Now you can begin to take the patient's blood pressure. When using the stethoscope, make sure that it is open on the larger side of the head. If you have a 2-sided stethoscope, you should be able to see the small circle in the center, switching back and forth when you rotate the head to determine which side it is on. When putting on your stethoscope, make sure the earpieces are facing forward, pointing towards your nose. Place the head of the stethoscope on the brachial artery, but not underneath the cuff. When you hold the stethoscope, make sure your thumb is not on the smaller head, as it can impact your hearing due to the pulse you have in your thumb. When taking a blood pressure, there are 5 Karat-Cough phases. Phase 1 and 5 are the ones you are listening for. Inflate the cuff to the value measured when you palpated the pulse, plus 20 to 30 extra, and slowly release the pressure at about 2 to 3 points per second. Phase 1 begins with the first sounds that you hear after deflating the cuff. This is the systolic blood pressure. It will be your top number of the reading. The second phase begins when the sounds start to fade. In Phase 3, the sounds become more defined and louder. During Phase 4, the sounds become muffled, and in Phase 5, the sounds completely disappear. This is the diastolic blood pressure. It will be the bottom number of your reading. If you don't pump up the cuff high enough, you can mistake Phase 1 with Phase 3, giving a false reading. After you hear Phase 5, finish deflating the cuff and take the cuff off of the patient. You will record the blood pressure reading on the hypertension assessment and can offer to write it down for the patient. When you inform the patient of their reading, make sure to be confident. Do not say might, maybe, or other wavering terms. Potentially offering a patient the wrong information will be detrimental to the patient and your relationship with them. If you are not confident in your reading, please offer to take the reading again. Thank you for watching the Wilkes University Nesbitt School of Pharmacy blood pressure training video. For further information on the hypertension assessment, please refer to video 2.